Our eyes are an intriguing and revealing facial feature. They draw attention and convey expression. Unfortunately, the signs of aging, as well as hereditary factors, can detract from the appearance of our eyes. The result may be that your eyes do not reflect how you really feel. Upper eyelids with excess drooping skin can make you appear sad or angry. Puffiness in the upper and lower eyelid or bags beneath the eyes can make you appear tired, even when you are not. Cosmetic eyelid surgery restores firmness to the areas surrounding the eyes, revealing a more youthful and alert appearance to the upper eyelids, lower eyelids, or both. Adults of any age, in some cases even in their 20s and 30s, may achieve a marked improvement in the appearance of their eyes through eyelid surgery. Eyelid surgery can restore or enhance contours around the eyes by removing sagging skin and reducing puffiness in upper eyelids and eliminating bags under the eyes. In addition, eyelid surgery can reposition the tendons of the eyelid to improve sad eyes, a condition where the lower eyelids sag deeply or where the outer corners of the eyes pull or droop downward. A brow lift may be recommended in addition to eyelid surgery to address the condition of heavy or fallen eyebrows and further enhance the appearance of your eyes. This program presents an overview of eyelid surgery, or blepharoplasty. It is not a substitute for a complete consultation with a plastic surgeon certified by the American Board of Plastic Surgery or the Royal College of Physicians and Surgeons of Canada. Eyelid surgery is best performed on healthy adult men and women. Good candidates for eyelid surgery are individuals who do not have a life-threatening illness or medical conditions that can impair healing. A positive outlook with specific and realistic goals for improvement of your appearance is essential. If you smoke, you are at increased risk of poor healing, including the formation of irregular scars, and therefore, it is advisable to stop smoking for several weeks before and after surgery. Certain health conditions may preclude you as a candidate for eyelid surgery or require special precautions. Therefore, it is important that you discuss your complete health history with your surgeon. These conditions include any eye disease or condition such as glaucoma, dry eye, or a detached retina, thyroid disorders such as Graves' disease or an under- or overactive thyroid, cardiovascular disease, high blood pressure, or certain other circulatory disorders and diabetes. A consultation with a board-certified plastic surgeon, a member of the American Society of Plastic Surgeons, who may also be a member of the American Society for Aesthetic Plastic Surgery, is the first step to learn how an eyelid procedure can enhance your appearance and improve your self-image. A consultation is designed to fully educate you regarding eyelid surgery. In general, a consultation will include a discussion of your goals, an evaluation of your individual case, and the options available to you for eyelid surgery. Your physician will also discuss the course of treatment recommended for you, the likely outcomes of cosmetic eyelid surgery, and any potential risks associated with the procedure. Your plastic surgeon will answer any questions you may have about eyelid surgery. During a consultation, you will be asked to share your expectations for your surgery and your personal health history. Full disclosure of your health history is important for your safety. You should inform your physician of any life-threatening illness or medical conditions in your family. You must also be candid about current medications, vitamins, herbal supplements, alcohol, tobacco, and drug use. By making the decision to consult with a board-certified plastic surgeon and following physician recommendations, you are taking an important step in helping to ensure your safety. A board-certified plastic surgeon is a physician who is specifically trained in plastic surgery of the face and entire body. Prior to your procedure, you will be asked to sign informed consent documents. These documents assure that you fully understand the procedure you will undergo, the potential risks and complications. In addition, you must commit to precisely following all of the instructions you were given. Instructions include pre-surgical considerations, such as testing and medications, day of surgery requirements, medications, and specific information related to the use of anesthesia. Prior to surgery, it is important to discuss all your questions with your surgeon and convey any concerns you may have regarding your surgery. Eyelid surgery may be performed in an accredited office-based surgical facility, an ambulatory surgical facility, or a hospital. Patients will either be under local anesthesia with sedation or general anesthesia. The decision for anesthesia will be based on the requirements of your specific procedure, any additional procedures that may be performed in the same surgical session, and considerations of patient and surgeon preference. Eyelid surgery is often performed in conjunction with other rejuvenative surgical procedures, such as a brow lift, to improve furrows in the brow and forehead and reposition low eyebrows, or a facelift, to restore a more youthful appearance to the mid-face, jowls, and neck. Laser resurfacing to smooth and tone the skin below the eye may also be performed at the same time as eyelid surgery. In addition, resurfacing can help reduce fine wrinkles below the eye and those at the outer corners of the eye, called crow's feet. Surgery to improve the upper eyelid begins with an incision within the natural crease of the upper eyelid. This allows for repositioning of fat deposits, muscle, and underlying tissue, and removal of excess skin to create a firmer upper eyelid contour. Conditions of the lower eyelid are corrected using one of two techniques. A transconjunctival incision is placed inside the lower eyelid. Through this incision, fat is redistributed, or some fat may be removed. The alternative technique is an incision just below the lower lash line, allowing excess skin and muscle in the lower lid to be reduced in addition to addressing the underlying fat and tissue. In limited cases, laser resurfacing may be an alternative to minimally tighten loose skin in the lower eyelid. Through an incision extending to the outer corner of the eye, techniques known as canthoplasty and canthopexy can be performed. These techniques reposition the lower lid tendons and can improve the appearance of a severely sagging lower eyelid and may improve downturned eyes to some degree. In general, the incision lines from eyelid surgery are well concealed within the natural structures and creases of the eyelid region. Fine sutures and possibly skin adhesives will close the incisions. Once your procedure is completed, lubricating ointment and cold compresses may be applied. In some cases, your eyes may be loosely covered with gauze. Before being released, you and an accompanying family member, friend, or caregiver will be given specific instructions that may include how to care for the facial skin following surgery, medications to apply or take orally to aid healing and reduce the risk of infection, specific changes to watch for at the surgical site or in overall health, and when to follow up with your plastic surgeon. Following eyelid surgery, you may experience swelling, bruising, irritation, or dry eye, and discomfort that can be controlled with medication, cold compresses, and ointment. Irritation at the incision sites is also possible. You may experience temporarily blurred or impaired vision as well as a tight sensation when closing your eyes. These are all common conditions. Complications associated with eyelid surgery are infrequent and include infection, poor healing at the incision sites, difficulty closing your eyes, and ectropion, a pulling down of the lower eyelid. All of these possible, though relatively uncommon complications, and the risks associated with anesthesia will be fully discussed prior to your consent. Your physician will instruct you to keep your head elevated at all times until initial swelling has subsided. You will be advised to wear sunglasses to protect your eyes from bright light, sun, and wind. Follow all instructions carefully. This is essential to the success of your outcome. A return to light, normal activity is possible as soon as you feel ready, usually within a day or two following surgery. Initial healing of incisions may take 5 to 10 days, at which time any sutures will be removed if necessary. You will be ready to return to work and normal activity at this time and to resume wearing contact lenses. Cosmetics can camouflage any bruising or redness that remains. Healing will continue for several weeks as swelling continues to resolve and incision lines improve. Diligent sun protection and consistent use of darkly tinted sunglasses is essential to protect the delicate tissues surrounding the eyes as they heal. Your final results will appear over time, generally within several weeks. It may be up to a year before incision lines fully refine. While eyelid surgery can be expected to correct certain conditions permanently, you will continue to age naturally. Whether your goals for eyelid surgery are to restore a more youthful appearance or improve upon heredity, eyelid surgery can help you look the way you feel inside, youthful, expressive, and alert. Choosing to undergo eyelid surgery or any plastic surgery procedure, whether cosmetic or reconstructive, is an important decision. So is selecting a plastic surgeon. Not all doctors who perform plastic surgery or who use the title of plastic surgeon are board certified in plastic surgery. In order to be certified by the American Board of Plastic Surgery, a physician must graduate from an accredited medical school and then complete a minimum of 5 years of surgical training, including an accredited plastic surgery residency program. The physician must pass a comprehensive written and oral exam in order to become a board-certified plastic surgeon. The American Society of Plastic Surgeons and the American Society for Aesthetic Plastic Surgery have prepared this educational program to supplement your personal consultation with a plastic surgeon who is certified by the American Board of Plastic Surgery or the Royal College of Physicians and Surgeons of Canada. Plastic surgeons with this certification have completed approved surgical training and rigorous examinations in plastic surgery, including both cosmetic and reconstructive procedures of the face and entire body.